Hello, I'm Dr. Vijay Patel of Advanced Physical Medicine and Therapy. I serve the Greater Mount Prospect and Arlington Heights area and the surrounding suburbs. Today I'll be talking to you about selecting the proper footwear for running and or walking. Most patients, when they select shoes, I'm going to go through the types of shoes that you can purchase. Number one, on the far left side or your far right side is the motion control shoe. Typically, we've been told that these were designed for those individuals that are over 180 pounds and tend to overpronate. This is a stability shoe. This here is a neutral shoe. This is a neutral racing flat, very light shoe, and this newer shoe is an anatomically shaped shoe, which it more looks like the shape of a foot. This tends to be a growing trend amongst a lot of runners and walkers. When selecting shoes, in my opinion, I tell most of my patients that you should most of them should select either a neutral shoe or an anatomically shaped shoe. The key factor to look at when you're purchasing a shoe is comfort immediately out of the box. If the shoe is not comfortable immediately out of the box, then don't expect it to become comfortable later. Often patients have said to me, well, the shoe doesn't feel good until I've run in it for about a month or two. Usually when you do that, the shoe is often reshaping or recontouring your foot, which is really not what should be happening. And when patients go purchase shoes at athletic stores, I tend to find that a lot of them tend to be pushed towards more of these motion control shoes when they're not necessary. Often these shoes are a little more expensive. It is always typically better to go with a neutral shoe. And most of my patients, I teach them gait training patterns, which help them to run efficiently, whereas they're not relying on any control that the shoe provides, but instead they are running correctly to minimize the risk of injury. When you look at the newer shaped shoes, which are the anatomically shaped shoes, what you'll notice is they're the actual shape of a foot. But when you look at the standard type shoe, if you look at this shoe here, it tapers like this. And usually I find that those patients' feet who look like these tend to have issues with bunions and or bunionettes. If your foot is shaped like this, you're less likely to have a problem. So when purchasing a shoe, my general recommendation is try to go with a neutral or an anatomically shaped shoe. Make sure it fits perfectly out of the box. And if you have any questions, feel free to reach out to us. Visit us at www.apmt.us or feel free to call our office at 847-222-9060, and we will do whatever we can to make sure you know how to select the right shoe. Thank you.